Now this is like a very simple checklist that I came across, but very nice and important one. If you want, you can have a copy of this later on. But this is something that I'm very sorry it's not very clear. But yeah, so it talks about what are the small things that you can do in your house to modify yourself at your level itself before you happen to have someone to come and check your house. Okay, so this is something that you can do for your floors. So first question is, when you walk through a room, do you have to walk around furniture? So is your house crowded with a lot of furniture? If that is yes, then you need to reduce the amount of furniture that you've got, because the more furniture you have, obviously the more susceptible for falls you have. Okay, second is, do you have throw rugs on the floor? If at all you have, it is always better to get a double-sided tape and put it underneath so that the throw rug actually sticks to the floor and it doesn't keep coming off, again preventing the risk of fall. Okay, are there papers, books, towels, shoes, magazines, boxes, blankets, etc. on the or other objects on the floor? So obviously if you have a lot of obstacles around, it is going to be very difficult for you to walk, and that is going to make you more prone to fall. Do you have to walk over around wires or cords? Again, it's very common nowadays to use extension cords at home, just for the fact that the plug is right there, you want to sit and work here on the laptop, or someone at home is working on the laptop here. Very common to have those extension cords like the one that we've got there. So that is a very high risk of fall. Okay, so it's better to modify your house in a way that you have the plug points closer to you without having the need to use an extension cord. Okay, now stairs and steps. Look at the stairs you use both inside and outside your house. So most of the times what we've observed is either the stair height is varied in some of the houses, especially if the houses are very old, 200, 300 years old. I don't know how the situation is, but the step height varies every time. So your brain that senses that, okay, I'm supposed to lift the leg up to a particular range, but if it keeps varying, it's a very big challenge for your brain to keep on changing the position of your leg as you climb up the stairs. So it is always better to see that you have even step heights. Okay, are there some steps which are broken or uneven? Again, that is, or even say the carpet on the steps that you have they come off from the edges? Is it something that you can change? Are you missing a light over the stairway? This is again something that is ignored. We tend to have lights at one end of the stairway and it's dark on the top or it's dark in the middle, and if you have to walk around at night, if you come down to have a cup of water or something, then you tend to have a fall again. So see to it that you have a well lit stairway. Okay, do you have only one light? So that's what we were talking about. Has the stairway light bulb burned out? So that's something that you need to ensure about. Is the carpet on the steps loose or torn? Then in the kitchen, are the things you are often on the high shelf. So basically, now this is something again that nobody would think of, is something arranging your kitchen things or the equipment that you use in a logical way so that you don't have to reach out on something that's kept on the higher shelf. So if you know that you're going to need something on a day-to-day basis, it is better to have it leveled up at your level, at your height level, and structure the kitchen counter in a way that obviously if you are by yourself, you do not have to lean onto something to get something from somewhere. Is your step stool unsteady? So if you're using a step stool and if it does not have those rubber funnels around it, it is quite likely that it can slip and that can lead to a fall. Okay. Now bathrooms. Is the tub or shower floor slippery? So that is one of the commonest things. Bathroom falls are the commonest of all. Okay. Do you need some support when you get in and out of the tub? So if you need one, then you need handrails there. So have you got one there? So we're going to talk about that shortly in the next slide. Then bedrooms. Is the light near the bed closer or hard to reach? So again, most of the times the houses that are structures, they've got one switch as you enter from the door, but you do not have a switch present closer towards the bed. So if you have to wake up at night, you have to walk till there, put the bedroom light on and then go to the bathroom or whatever that is. So it is better to ensure that you've got a switch closer to your bed, okay, or you have a night lamp or something of that sort. Where were we? Yeah, and other things that you can do to prevent fall. So first and foremost thing is exercise regularly. How is that going to help? Exercise makes you stronger and improves your balance and coordination. That is there for sure, but it also helps you develop a very strong core. The stronger the core you have, the better it is to balance yourself. Okay, now the simple logic behind that, it is something, it's like a physics principle. Yeah, you know something called as center of mass. So every object has a center of mass where gravity acts the most. So in our body, our center of gravity lies in our lumbar spine, the lower back. Okay, the muscles that surround your lower back is something like the core muscles, your abdominal muscles in the front, your back muscles behind. All of these help us stand erect. If they are not strong enough, what you're going to do is stoop forward. The moment you're going to start stooping forward, the center of gravity is going to fall forward, and that is going to make you more susceptible to falls. Right? So exercise is all about building up the strong core so that you do not have any of these issues. Now have your doctor or pharmacist look at your medicines. Now this is another important thing which is called as polypharmacy. So if you happen to take lots and lots and lots of medications, every medication has its own side effects, right? Some of these can be nausea, vomiting, or dizziness, fatigue, lots of side effects. So if you happen to take many medications, that's where you need to go and talk to your GP or your consultant straight away to reduce the number of medications that you take. Is there any other way out that you can solve the same problem without having to take a lot of medications? Okay. Have your vision checked. So vision is one of the important factors. So if at all it is affected, it's better to see an optometrist. Get up slowly after you sit or lie down, that's fine. Shoes. Now it is always better to wear shoes inside and outside. Wearing flip-flops or slippers is not a great idea because again you are highly prone to have a fall. So if at all you need to wear footwear inside the house, it's better to wear something like a slip-on shoe or something of that sort. Okay. Improving the lighting in your home, that's a repetition, and it's safest to have uniform lighting. Now nowadays in modern houses you have different lights. So as you start walking, the light appears, and then the lights keep on changing as you keep walking, or even on the stairs that I've observed, at every step you have, the light comes up with different colors. So that has again a negative impact because obviously you're confused, you don't know what you're doing, especially when you're walking at night or in that sleepy mode on. That's going to again have a susceptibility to fall. Okay, not only that can happen to anybody for that matter. Okay, and paint. So it's always better to have a contrast paint in the area that you are in. Contrast paint as in, if at all if you have a darker flooring, it is better to have a lighter paint on the wall because that lights up the room and that will again have a less impact on you. Okay, can we change?